Just take a moment to breathe, to be and to feel. Whoa, whoa,
Well, switching gears now, if you have difficulty getting to sleep, staying asleep, or if you wake up in the morning feeling just exhausted, you might have a sleep disorder. Ear, nose, and throat specialist Dr. Tykie Skedros is joining me to share a possible solution. Thank you so much for being here.
Yeah, thank you.
I just covered a lot of different symptoms. What could be happening with those sleep-related symptoms that I mentioned?
Well, typically, and I'm a specialist in sleep apnea management, typically people snore at night and they stop breathing, and then the next day they wake up and they are exhausted, they're tired, their concentration's been affected.
Even after a quote-unquote full night's sleep?
Yeah, they can have a normal night in bed, but unfortunately the next day they don't function very well.
Well, you mentioned sleep apnea is your specialty. What causes it exactly?
So people obstruct at night because of airway issues, and it could be the nose, it could be the throat, it could be the tongue, so all those areas can come into play. Unfortunately, weight factors in as well, so the heavier someone is, the more issues they'll have with weight around the airway.
Mm-hmm. So you're having that health conversation with your patients quite often.
Yep.
What other solutions are out there, though? How are you providing relief?
So usually the gold standard to manage sleep apnea is CPAP, and CPAP a lot of people are familiar with. And it's where you wear a mask at night, and there's a little machine by the bed, and air blows into your airway to keep it open. So that's probably gold standard. The next way we like to manage people is we use a mandibular device, and that's a mouth guard.
Okay. Is that effective?
Oh yeah, they work.
I mean, because
they could be uncomfortable.
Well, you compare the small mouthpiece to the big sleep apnea machine that we know about, and you just wonder about the effectiveness between the two.
Yeah, so it's more for mild to moderate sleep apnea.
Okay.
But it's got an upper tray, a lower tray, and that's how you sleep all night.
Just like that.
Yeah.
Is surgery ever considered? Is surgery an option?
So surgery is reserved for the patients that fail those, conservative techniques. And surgery can be very, very effective. And again, that depends on someone's weight, it depends on their anatomy, it depends on, how severe the problem is.
But definitely more of a last resort.
Typically, but occasionally you'll see someone with huge tonsils and you take them out and they're fixed.
And they're okay.
Yeah.
Well, I know you've helped so many people find relief, and what's the feedback you get from patients after you try these treatments and they're effective?
Well, my favorite line is I always ask patients if I'm going to get a Christmas card from their wives. When they stop
That's
snoring.
That's a good one. That's because now they're both sleeping better.
That's right.
Thank you, Dr. Skedros. Yes, absolutely. How can people schedule an appointment?
So ogdenclinic.com, and I'm on the internet as well.
And that works for their better half too. They can schedule.
Yep.
I'm sure you get appointments scheduled for people as well sometimes.
Yep.
I believe it. We'll link you over to that website from our website to make it easy. Thank you so much. Great to have you.
Thanks.
Coming up next.